Okay, next question. Hello, I am from Mexico, and I was wondering if you can give me some insight about test and HGH. I am 23 years old, and I want to know what risk I might be taking if I wanted to use test 2 times or 2 cycles in a year, or will I be better off trying HGH? I train CrossFit and Olympic lifting, and it seems that I've hit a wall, been stuck at the same weight, even with a bulking and mass gaining diet. Any long-term side effect I might regret? Diego. Best regards.
Well, feel free to edit this because there's a long answer and a short answer. I mean, the short answer is, will testosterone help you with that? Maybe. Because it's just not that easy. Everyone likes to think that it's all about the drugs.
Yep.
You still have to eat right, sleep right, and of course train right. And I say, of course, train right. Training right is the easiest part, right? We love going to the gym. That's an hour, hour and a half out of your day. And then it's the other 22 and a half hours that are the hard part, getting the frequent meals in, getting the proper balance in your meals. And these days, just as hard or harder is getting enough sleep. That's the rest time. It's easy to write the prescription for muscle. The hard part is filling the prescription, getting the right amount of rest and the right amount of food in your body. Now, we're talking about Olympic lifting, CrossFitting. That's a lot of technique. And I can't see the technique you're using, but I know one of my good friends, he won't mind my mentioning here, John Peretti, the guy who started MMA. His sons are both champion Olympic lifters for their age, and they're young. They started back when they were 11, maybe even 9.
Wow.
And I think Enzo was 9 and Luca was 11. But anyway, they're not using steroids. They're using their natural body system, and they're training for, to use their technique. And I know this is getting probably too far off subject, but what I'm saying is it's not just about adding some testosterone or growth hormone to the system. Now, you can go back and say, though, if you're deficient, absolutely it's going to help. Just like if you don't have enough B vitamins in your diet, then yeah, supplementing with B vitamins is going to help you. And I don't mean to be like a smartass about it, but it's just not that easy a question. Yeah, it's possible. It's unlikely at age 23 that you don't have enough testosterone. You might be suppressing your own testosterone by overtraining. That's another thing that tends to slow you down. And I appreciate being eager. I'm number one overtrainer, so I'm not pointing fingers. But that's something to consider as to why you might have hit a wall. So you got technique. Your training, overtraining. The best way to answer that question would be to go in and get some labs to see if your testosterone and or IGF-1, that's how we would measure your growth hormone levels, are low. Is it because you're overtraining, which athletes, contrary to popular belief, tend to have lower levels of testosterone, not so much IGF-1, but testosterone, because we often overtrain, right?
Because we like it so much.
The other thing I wanted to mention is that, I think we've addressed this before, the potential for side effects down the road. We really don't know. I mean, at this time, testosterone was discovered in 1935. A lot of people used it in the 1950s through 1976 when it was officially banned in the Olympics. And, we don't have an increase in two-headed babies or anything like that. Is there an increase in hypogonadism secondary to using steroids when you're too young? I think we're still standing by officially at age 26, you're fully developed. You don't have to worry about disrupting the HPA axis. That's open to debate because we know plenty of people that started using testosterone or steroids at age 18 and have a family of 6. I can't say that in looking to patients that have a history of using steroids or testosterone at age 18, let's say, that there's necessarily a problem, because it's hard to tease out what's doing what. Is it just the fact that we're alive in this era and stress kills testosterone levels, again, overtraining, all that kind of stuff? So the answer to that is we don't know. The older you get, the less risk you have, and of course the way you do it. If you want to minimize the chances of long-term depression of your own production, then a shorter cycle, perhaps more intense. There's no need to use higher dosages though, but a shorter cycle is probably safer. It's chronicity of use that's more of an issue, although you can then look to women who use birth control. They are suppressing their own production of hormones, and yet a woman may start at age 15, 16 to avoid pregnancy using oral birth control pills and go for 15 years, go off them, and within a month, sometimes, maybe 3, they can get pregnant. So again, I'm just saying what I said before. We don't know if the suppression of the testosterone production will be a long-term issue or not. It seems to me that just like with the women in oral birth control, it does bounce back.
Mm-hmm.
I'm not sure that if for example, if he were my son, that I would not object to him using it. Again, legalities aside or ethics aside, okay? The AMA would not approve of using testosterone at age 23 unless we had ruled out a pituitary adenoma or some reason for the testosterone deficiency, and of course he would have to be testosterone deficient to replace it. But again, that aside, you know, I would wait till you're 26 just to be on the safe side. Yeah. Not to be dad, but you know, just to make sure that you're not interfering with the development, the so-called hardwiring, which we realize isn't so hard after all. But the development of the system, which again we figure is pretty much done by age 26.
Plus, I'd like to add that also. I mean, you were mentioning, you know, there's a lot of factors such as, you know, does he eat properly, does he train properly? When you're 23 years old, there's a big chance that you're not doing everything right that you should be doing in the first place. So when you better to actually wait a little longer until you learn about nutrition, about training, until you have all the tools, and then use steroids or use, you know, it would work a lot better. Wouldn't you agree?
Yeah, absolutely. And this is part of the, I mean, I love doing these things, but it's part of the limitation of this. And that's why, you know, I posted a disclaimer at the end of all these, because I don't have this person sitting in front of me. I don't have the ability to ask them these questions and say, you know, medicine is still, I wouldn't say largely art, but it involves a lot of art because we can't test everything. So if somebody's sitting across from me, and you can see when someone's overtrained, you know, the classic signs of, you know, even dark circles underneath the eyes, puffiness, look tired, the muscles don't look full, they look flat, okay, because there's no glycogen left in them, you're overtrained. I could be able to spot that right away and say, okay, I know which way this is going to head, this conversation. I don't have the ability to ask him about how he trains in the gym or watch him, you know, throw up, see how he's snatching and clean and jerking. So I'm just trying to approach it from as many angles, trying to answer the question and generally.
Yes. Thank you, Doc. Okay, Doc, a question from India now. Hello, sir. My name is Deepak. I'm from India, 24 years old. I've been lifting for 5 years, and recently I had a knee injury. A doctor told me it was a minor patella injury. I've lost some strength in the injured legs. It's bothering me real bad now. I gave it some rest, took anti-inflammatory, did everything possible for the recovery, but I'm not getting better results. So I'm thinking to use DecaGH and HGH for a cycle to help me recover. Is it okay to use both, or is one compound enough? Or please tell me any other way you would think of to speed up recovery. Thank you.
Another tough one, because if I listen correctly, we're not sure what's going on with the patella. Again, so many things.
You only said it's minor, but whatever.
Does it sound like he's saying that the patella injury has healed and he's frustrated with recovery?
I think it's the recovery that he's
strength return in the leg, or it still hurts and
no. It sounds to me like he. It sounds to me like he's talking more about he's weaker now that he hurt it.
Okay,
he injured it before, so he's talking about recovery.
If the patella injury has healed, then it's a simple question: will the use of DecaGH hasten recovery? Probably. You know, that's what it's for. DecaGH is roughly 3-to-1 anabolic to androgenic. I say 3-to-1 as opposed to testosterone, which we use as a base. 1-to-1 anabolic to androgenic. It also tends to stimulate the appetite. It's for wasting, and it's also for repairing torn muscle, not repairing torn muscle, but helping recuperate after a tear or an injury to the muscle. So that's an easy question to answer. Now, again, that's aside from the fact that I don't know what the law is in India, but here, he would be too young to be using DecaGH again, unless he's hypogonadal. But that's a drug that is used very well for healing.
For healing process.
Now, as far as the injury itself, maybe I'm giving him more of an answer that he wants, but you want to look into why the patella got injured to begin with. Tracking of the patella is important, and if you have knock knees, as we say in the vernacular, versus bow legs, the tracking of the patella will be different. And if you draw a plumb line from the hip to the dorsum of the foot, you can see when you're standing there, whether you actually use a plumb line or an imaginary one, on what side of that plumb line the patella is, and therefore tracking. And so you can repair a weakened patella or an injured patella by realigning your leg. And people think of the knee as a joint, which it is, but it's really just sort of two sticks stuck together with a bunch of duct tape, if you will, okay? But you can manipulate the bow-legged versus the knock-kneed aspect by developing certain muscles. So, to prevent it from coming back, again, unsolicited advice, you might want to look into it and see, okay, obviously, for example, if he's knock-kneed, then the plumb line is going to be to the outside of the patella, which means he should be experiencing pain on the lateral aspect. If he does a lot of leg extensions to work with the vastus medialis muscle, he will eventually move that knock-kneed position into more of a straight-legged position, and then the patella will ride properly inside. There's looks like a little boat on the bottom underneath the patella, and it rides inside something that fits that positioning, and it won't be knocking on that lateral side, and then recovery and avoiding injury will be easy from there on. But the rest of that's an easy question. Does DecaGH work to heal? And I think he also mentioned
should he do
growth
GH?
hormone?
Growth
hormone absolutely will help. I think one of the things that's happening now, and again in India, I don't know what's going on in terms of the pharmacies, if you will, and of course the laws either. But growth hormone is so expensive here in the United States.
Crazy.
That I wouldn't necessarily throw that in there, and I'm giving a practical answer when I guess I'm supposed to be giving a medical answer, but it leads to the medical answer too, which is 95% of what he's probably looking for would be obtained just by using an anabolic rather than combining it with growth hormone.
Yeah, great. I bet he was here to talk to you in person. All right, thanks, Doc.